Hello, this is Special Education video series and my today video is about dry mouth. What is dry mouth? What causes dry mouth? What are the symptoms of dry mouth? And will I need tests? How is dry mouth treated? What else can I do on my own? So these are certain questions we need answers. What is dry mouth? This is when there's not enough saliva, spit in your mouth. Having enough saliva is important for achieving swallowing and digesting food. Dry mouth is also called Zika and xerostomia. What causes dry mouth? There are many different causes. Sometimes a person might have a dry mouth if they have been breathing through their mouth. Dry mouth is more common with older age. Other causes of dry mouth include dehydration, infection in the mouth, certain health conditions such as Sjogren's disease, certain medicines, cancer treatment like radiation or chemotherapy, surgery for the head and neck cancer, a problem with the gland to make saliva, and smoking. What are the symptoms of dry mouth? A sticky feeling in the mouth, thick and stringy spit, bad breath, mouth pain, cracks in the lips or tongue, sore throat, trouble swallowing bulky foods like bread without water, and trouble speaking naturally. Dry mouth can lead to other problems like cavities, gum disease, or fungal infection. Will I need tests? It depends. Your doctor or nurse will do an exam and ask you about your symptoms. If it's clear what is causing your dry mouth, you probably will not need tests. If the doctor is not sure of the cause, they might do tests to check for the health problems that can cause dry mouth. How is dry mouth treated? Now, treatment depends on what is causing your dry mouth. For example, if one of your medicine is causing dry mouth, your doctor might switch you to a different medicine. If you have a health condition, your doctor will talk to you about how to manage it. If your body is not making enough saliva, you might get medicine to help with this. You can chew sugarless gum or suck on sugar-free candy to help with dry mouth. You can also try artificial saliva. This comes as a liquid, spray, or gel that make your mouth less dry. Your doctor might prescribe medicine to help you feel less dry. What else can I do on my own? You can keep your mouth moist by sipping water. If you don't like drinking a lot of water, you can rinse your mouth and spit the water out. Sip water during meals. This can make it easier to chew and swallow the food. Use lip balm if your lips are dry. Use a cool mist humidifier in the room where you sleep. Why smoking? If you smoke, your doctor or nurse can help. Brush and floss your teeth after every meal. And see your dentist as often as your doctor or nurse tells you to. Dry mouth raises your risk of cavities and some other mouth problems. Thanks.